Hello. We generally never pay attention to most of the advertisements that appear in newspapers. Do you remember today morning's newspaper and do you remember any advertisement that you saw in it? Well, it's most likely you have not. However, I was particularly attracted to this particular advertisement by a multinational company. And that multinational company is in the market for selling continuous positive air pressure or CPAP machines for the treatment of OSA on the prescription of a pulmonologist, the super specialist who deals with the conditions of OSA in patients. All forms or severity of OSA are generally accompanied by snoring. There are three well-known treatments for OSA. One is the CPAP machine, that is continuous positive air pressure machine. Number two is surgery in the roof of the mouth, which is carried out by ENT surgeon and is called UVULOPALATOPHARYNGOPLASTY. Now, that can regrow, it is said so in the literature. And the third treatment available or recognized is oral appliances as delivered by a dentist. Interestingly enough, the advertisement does not talk about OSA. It concentrates itself on snoring. Snoring is a very serious problem, and more than 50% of the individuals in our country are snoring. And this includes both males and females, and all kinds of economic strata are involved in this. That means millions of people need help so far as snoring is concerned. At this point, it is important to understand what really is snoring. Snoring is an upper respiratory tract disorder caused by the distal positioning of the mandible and the tongue during sleep, causing a obstruction or pressure on the windpipe, thus it is reducing the size of the windpipe. When air during breathing passes through this reduced opening, it causes vibrations of the tissues surrounding this area. This vibration causes a sound which is known as snoring. Most people think that the sound of snoring comes from the nose. It is not so, it comes from the throat. Snoring leads to a number of medical problems and can even cause death. In India, we do not understand this at all, or rather, it's understood very less. We think that a person who's snoring is actually thoroughly enjoying his sleep. It is not true. A person who is snoring, his body is actually crying out for help. Oral appliances made by the dentist help in repositioning the mandible and thus reducing or removing the pressure of the posteriorly placed tongue and mandible on the windpipe. The mouth is the area of work of the dentist. We should not forget that. How can we forget that? Okay. Unfortunately, dental colleges in India do not cover this as a part of their curriculum, and most of our students, or even me for that matter, we are not exposed to the treatment of snoring by oral appliances. The branch of dentistry dealing with OSA and snoring is a multi-billion-dollar protocol in the treatment protocol in the United States of America. You'll be happy to know that every dentist can enter this field of treatment protocol. It is including oral appliances and snoring raises your status to that of a lifesaver. No other procedure in dentistry helps to save life. Remember, I told you the medical problems that arise in persons who are snoring can even lead to death. The multinational company sells directly to the population on the basis of snoring and earns hundreds of crores in the process. And we don't do anything because we were not taught this part of applied dentistry in our dental colleges. Mind you, this is just basically applied dentistry. You will know all the components of how to do it. It's just that applying yourself, and that's the link which is missing. It is in our interest not to complicate matters by going for sophisticated tests like polysomnograph, etc., for confirming the diagnosis for OSA. These tests are generally ordered by the super specialists, the pulmonologists who treat the OSA. These tests are so sophisticated that even an MD physician is not able to read these tests. How many of us as dentists are able to read a cardiogram for that matter? The diagnosis is not required because the family and the friends and of course the spouse are enough to confirm the diagnosis of snoring. As dentists, we should confine ourselves to the treatment of snoring. Sell directly to the patient suffering from snoring. The multinationals do the same. You would be better placed to do the same. Remember, our claim to treatment of snoring with oral appliances is stronger than that of the multinational trying to sell CPAP machines for snoring. The area of the mouth, remember, it is our field of work and we must grab it. CPAP machines cost a fortune. All our countrymen are not so rich to afford these. And mind you, there are a number of cases where CPAP machines are not tolerated. So here you have a huge area waiting to be entered into by the dentist. And mind you, I said every dentist can do it. This will help reach out to our millions of our countrymen and providing good services and good health to our countrymen. Add this modality to your dental practice today and prosper. You can learn online at www.indianinstituteoforthodontics.com. Thank you very much for a patient hearing.